Hi, welcome back to Focal Point AFR Talk. Brian Fisher is my name. The program Focal Point, the network, American Family Radio Talk Network, AFR Talk. Now, as you're aware, there is going to be a vote tomorrow to defund Obamacare in the House, on the floor of the House of Representatives. It is going to the floor. It's going to get a vote. It's not the Tom Graves bill, but it's the same thing, only a shorter time frame. The Tom Graves bill would have applied to the entire next year. The bill that's going to be on the floor tomorrow will defund Obamacare and for the whole year. It'll defund Obamacare, period, and it will provide some kind of temporary funding for the government through the middle of December. It'll fund government through December and defund Obamacare. Then they're going to have to figure out what to do with funding in December, but this is a bill that will defund Obamacare. So we want to encourage you to make one more call to your congressman. All the Republicans, from what we're able to understand, all 218 Republicans are on board with this, 235 of them are on board with this, are going to vote for it tomorrow. They are standing strong, standing tall. Kevin McCarthy said, I've never seen greater unity in the House of Representatives. I want to give a shout out to my congressman, Alan Nunnally. He is going to vote for this thing. He's going to vote tomorrow to defund Obamacare. He's been weighing this out, and he's decided he's going to cast his vote tomorrow to defund Obamacare, so I'm going to give a shout out to him. But this is an opportunity to call your congressman one last time and urge them to vote tomorrow to defund Obamacare. You might have already called them once. It's worth calling again because it's important that they understand that we are monitoring this, that this matters to their constituents. This is important to them. So give them a call and just urge them today. Just call, and all you got to do is leave a message. And if it's a Republican congressman, then it should be pretty easy peasy. Just say, I want to encourage my representative to vote to defund Obamacare tomorrow morning. Trust me, they will know exactly what you are talking about. Now, the Obama administration is naturally upset with the Republicans because they want to delay Obamacare for a year. That's what this defunding thing will do, is it will delay Obamacare. It doesn't repeal it. It doesn't overturn it. It delays it. So there's still a lot of work that's going to have to be done, but this will stop this flaming train wreck. It'll stop this train, this engine that's bearing down on us. It's on fire. It's aflame. It's bearing down on us. We are tied to the tracks, and this bill will stop that flaming engine, that flaming train in its tracks. So it will delay Obamacare. Now, this is exactly what Obama's done with the employer mandate. And here is Ed Henry, clip 4, Fox News, talking to Jay Carney about this thing. Here's how their exchange went.
You say it's such a bad thing for Republicans to want to delay the health care implementation. The president has delayed pieces of the law, and you've said that was a smart way to do it. We need to more slowly implement it, help businesses deal with it. So if the Republicans come up with it, why is it such a bad idea if they say, let's slow walk some pieces of this? When you do it, it's perfectly fine.
Ed,
well, you did, right? On the businesses, you said they can delay.
On the employer responsibility provision, which represents a very small portion of the implementation of the Affordable Care Act, it was the right and responsible thing to do, reacting in part to the requests of businesses to delay implementation of that for a year.
So Jay Carney says, hey, it was right and responsible, reacting in part to the requests of businesses. Now, remember, Barack Obama's supposed to be, he's the guy that's against Wall Street. He's against big business. He thinks big business is bad. He demonizes big business all the time. They're greedy. They're pilfering you. They're lifting money out of your wallets. I'm for the little guy. I'm for the individual. I'm for the guy that just wants to break into the middle class. That's who I am. Well, so the businesses go to President Obama and they say, please give us the delay. He says, fine. Individuals like you and me, we go to President Obama, please give us a delay. He says, get out of town. I'm not even going to negotiate with you over that possibility. So Ed Henry, so what this means now is the media is on to this inconsistency and this double standard that's coming out of the Obama administration. And Ed Henry's question is a great one. Hey, why is it okay for you to delay parts of Obamacare, but it's a bad thing then when the Republicans want to do the same thing? And speaking of the problems of Obamacare, let's play clip 5. Let me drop down, Rob. I want to grab that clip from President Obama. It's clip 14. This is clip 14. And I want you to hear particularly what President Obama says at the end of this clip, and then we'll play the next soundbite, which completely shatters the narrative he's trying to spin here. Clip 14, President Obama, this is his, I think this is his speech before the Business Roundtable. Let's listen.
So let's put this in perspective. The Affordable Care Act has been the law for 3.5 years now. It passed both houses of Congress. The Supreme Court ruled it constitutional. It was an issue in last year's election, and the candidate who called for repeal lost. The Republicans in the House have tried to repeal or sabotage it about 40 times. They failed every time. Meanwhile, the law has already helped millions of Americans. Young people who are able to stay on their parents' plan up until the age of 26. Seniors who are getting additional discounts on their prescription drugs. Ordinary families and small businesses that are getting rebates from insurance companies, because now insurance companies have to actually spend money on people's care instead of on administrative costs and CEO bonuses. A lot of the horror stories that were predicted about how this was going to shoot rates way up and there were going to be death panels and all that stuff. None of that stuff's happened. And in 2 weeks, the Affordable Care Act is going to help millions of more people. And there's no serious evidence that the law, which has helped to keep down the rise in health care costs to their lowest level in figures, is holding back economic growth.
So as President Obama says, look, there is no serious evidence that the law is holding back economic growth. Well, I give you, let's say this is clip number, where was I, Rob? Clip number 5. This is a news story about Cleveland Clinic and what they're going to have to do in response to Obamacare. Remember, he's the one that said, look, hey, there's no evidence this is having any serious economic consequences whatsoever. Let's listen.
For the first time in more than a decade, the Cleveland Clinic has announced that it will be laying off employees. At this point, we don't know exactly how many jobs are on the line, but we do know that 58,000 households in Ohio are supported by clinic jobs. So this announcement has a lot of people on edge. From janitors to doctors, layoffs at the Cleveland Clinic could affect every employee.
Yeah, I guess we're a little bit, worried.
Veronica Smith is a registered nurse at the clinic. She's been here for 1 year. She, along with every other employee, was invited to a meeting earlier this morning where clinic CEO Dr. Toby Cosgrove made the announcement. The looming cuts are part of a multi-year plan to trim about 5 to 6% from the clinic's budget before the Affordable Care Act takes effect. Channel 3 received this statement. To prepare for health care reform, Cleveland Clinic has had an ongoing focus on lowering costs while making health care affordable to patients. Although we have made progress, we need to further reduce costs to the organization by $330 million in 2014.
All right, so there you go. By the way, number to call if you want to join our conversation today, 888-589-8840, 888-589-8840 is the number to call. And, President Obama says, look, no serious economic consequences. There's no evidence this is having any kind of negative consequences. Here is a hospital, Cleveland Clinic. They're laying off an unspecified number of people because they got to find a way to cut $330 million from their budget because of Obamacare. They specifically say, look, this is because of the, quote, affordable, end quote, Care Act. And you start asking the question, here's a story, Vanderbilt University Medical Center, they're cutting hundreds of jobs. They got to get it done by December 31st because, of course, the Obamacare thing kicks in on January 1. They're out there planning to lay off 1,000 people by the end of the year. Vanderbilt University Medical Center, Cleveland Clinic. Now, ladies and gentlemen, here's the point I'm getting at. These are health care facilities. These are people that take care of sick people. This is where people who are sick, this is where they go. When people have health insurance, this is where they go for help. What's going on? These health hospitals and these clinics are laying off medical care workers, healthcare workers in droves. Several hundred at Cleveland Clinic. Got another hospital in that area, 450 last year. Here's Vanderbilt University Medical Center. The largest employer in the region in Tennessee, they're going to lay off 1,000 people by the end of the year, and it's all related to Obamacare. So here's a question. I mean, obviously, these people, this is a tragedy. These people, if Obamacare wasn't around, these people would still be employed. They would still have jobs, but they don't because of Obamacare. So they've lost their jobs because of Obamacare. They've lost their health care because of Obamacare. And here's the question you got to start asking yourself. If all of these hospitals and these clinics and these healthcare centers are laying off everybody, who's going to be there to take care of the sick people? Remember, President Obama has been bragging about the fact we're going to provide health care for another 30 million people. Well, who in the world is going to be there to take care of these 30 million people? These 30 million people, they're going to be in the same line that the rest of the uninsured are, looking for somebody to help them. So I just don't see any way that this thing works. Let's grab a phone call before the break. Let's go to Paul, Dallas, Texas. If we can grab Paul. Welcome, Paul, from Dallas, Texas. What's on your mind?
Yeah, I just want to say when the president stands up and he says, hey, you know, all this talk about death panels and costs going up and stuff, that hasn't happened yet. Well, first of all, there's been more than enough stories about insurance rates already going up in anticipation of Obamacare. But the big thing is he must think we're really a bunch of idiots for saying, oh, the death panels haven't affected us yet, when the law for those hasn't even kicked in yet. I mean, it's like passing a law that's saying, I'm going to put a gas tank additive in 2016. What are you worried about? Nobody's car is broke yet. You know?
Right.
Yeah, because it hasn't kicked in yet.
Yeah. Well, you know, and that's a very good point, Paul, and I appreciate the call. Thank you. It's a very good point. You know, and speaking of these death panels, I mean, you can look over at the National Health Service in England, and you got death panels in spades over there. You got literally thousands of people have died over there that have been abandoned in hospitals. They're dying on gurneys in hospital hallways because they're put on this Liverpool care pathway. And there's thousands of people who have died prematurely in England because of the government health care system. You have the Medicaid system in Oregon are denying people. They're denying people chemotherapy because they're too old. That's a government-run system. The death panels are already kicking in. Focal Point AFR Talk, back in 2.